or that hardening of the arteries, okay? That's what that means. So again, as I said, understand what the problem is before you go and then try to learn the other information. Arteriosclerosis is the major cause of CAD. So make sure you know that. It's the major cause of that disease. Stages, this is a good visual for you of that, okay? The fatty streak here, I got that, so you may have to enlarge that, but it's spelled out down here at the bottom of the scale. C-reactive protein, I mentioned that before for the, when we talked about the MI. It's a non-specific marker of inflammation. Inflammation only. Here's vessel occlusion. So when we want to look at coronary artery disease, we're looking at that arteriosclerosis, which is the hardening of the artery, and we want to know what is the percentage. So the doctors are going to find out and try to determine what is the percentage of the occlusion in someone's artery. And so this is normal, this is not, but you can see it's starting, this is real bad. Someone who has 70 to 90% occlusion, that is not good. They're probably in line for having an MI, okay? So I'm going to skip the case studies, I just skipped a few there. Risk factors, non-modifiable, okay? We can't change these things. So they put the person at a great risk, okay? Bless you. But the modifiable, so I want you to know both. These can be changed. Now, I talked earlier about cholesterol, triglycerides. So, this is what puts the person at greater risk. Cholesterol greater than 200. Ideally, we want your cholesterol to be under 200. If you remember nothing else about that, just know that the cholesterol level should be under 200. You'd like it to be like, 120 or something. Triglycerides I spoke about, the greater than 150 is not good. We talked about the HDL and the LDL. Okay. Major modifier risk, hypertension, that's genius. That's modifier. The goal for someone greater than 60 is less than 150 over 90. Now, what you have to look at is every patient is different. So the doctor will determine where they want that person to be. So when you're trying to determine what's appropriate for them, you may have to ask them, what has your doctor told you in terms of where they want you to be? Okay? So, it's doable. Major tobacco use, we got to get rid of that. We got to change that. Physical activity. Can we change these? You bet we can. So with Mr. CS there, he can change all of those particulars that related to him and improve his life. Diabetes. Is that modifiable? You bet it is. Listen, patients who have diabetes have many of the other chronic problems. They have kidney problems, they can have vision problems, they can have cardiovascular. And do you know, if that patient with diabetes makes a change in real quarterly to their diabetes, those other ones will improve that. Those other major problems will improve and that person can live a healthy life. So if they just take care of their diabetes, then they can take care of some of the other major problems. Metabolic problems can happen as well. Okay. Contributing modifiable, psychosocial, substance abuse. Again, all of that can be changed. risk factors for coronary artery disease that increase the workload of the heart and increase myocardial oxygen demand are. Would you say that's a positive question? Yeah, you are identifying. Yeah. Yeah. So what would be your answer?
B.
So we're looking for two that increase the workload. Okay, let me say risk factors for coronary artery disease that increase the workload of the heart. No, it's a negative. It's a negative question. Sorry. And increase the oxygen demand. Very good. Hypertension is the answer. Now, if it's a test question, this is kind of a knowledge question the way it's formed. I would probably take that question and change it to more of a critical thinking situational question and then have an answer. So when you're studying in your group, that's what you want to do. You want to get an understanding of the information and then pose questions that are kind of like that have that critical thinking aspect. Rather than do questions, form questions. If you don't have an NCLEX book already, I would say get one. Now, in the library, now in the computer center, we have on the desktop NCLEX 4,000. 4,000 questions. When you are here early or you have downtime, go in there, pull that up. What's that? If you get here early, whatever, go in there and sit and pull up questions. It'll let you pull up questions that are based on where you are. So, like your cardiovascular, pull up questions and then do questions that will kind of help you understand once you have a good grasp of some of the information.
Where did you say it was at?
In the computer lab, and it's the second floor. On the second floor, and then there are certain computers, and on the desktop it has the NCLEX 4,000. You can just ask one of the people, say which of the computers that have the NCLEX 4,000. All right. I love teaching what I do. Okay. So, education is going to be important. Nursing. So for this, I want you to pay attention to your nursing role. What is your responsibility in patients with CAD? Well, we talked about it. They need to make a life change. And how can you have an effect on that? Well, teach them about the appropriate diet. Teach them about the exercise to do. And in fact, come up with a plan like I mentioned. Okay. Okay, dermatology. We know that as the person ages, that increase for CAD. Labs. You're going to look at your lab. And you're going to teach the patient about visualization. So all of those things that we can make a change. But make sure you look at these, okay, guys? Because I'm just going to be really fast. Last but not least, now I skipped 36, so don't worry about it for me for testing.
Since you didn't put anything on the PowerPoint on the first slide saying like
No.
no specifically this, you just want to know everything.
Yeah, this particular one has what?
124 slides.
124.
Well, I tell you what.
You uploaded?
I might go back. Well, I might go back for this one. I'll go back and see what I can adjust in it, okay?
Thank you.
For this particular PowerPoint. And then what I'll do is do the first page, like I did. I'll put what I want you to focus in on, and then I'll delete this one and pick out the next.
Thank you. Thank you.
All right, I know it's a lot, guys, I know. I think back, now that I teach, I'm like, how did I do it? Here's what I want you to know. What drugs are used for chest pain when the patient comes into the ED? So, to help you remember, that is the acronym. So, the acronym to understand and remember, the first drug is oxygen. The second one is aspirin, and we're not talking 325. We're talking what? 81 milligrams. That's what's used for cardiovascular patients. Nitro, and I think the IV though, the nitro, you know what I'm saying, is used. And then morphine. So the way to remember that is old acronym named MONA. You see, O is for what? Oxygen. Old acronym. A is for aspirin. Old acronym name. Name is what? Nitroglycerin. MONA. Morphine. There you go. Okay. Okay, so this one I will go back. So I'm gonna go back to that one and do it over for you. I'm gonna go to the PAC now. PAC chapter 37. Peripheral artery disease. You see how many chronic problems there are now in society? Okay. So, now we're looking at, again, still arteriosclerotic related, but we're looking at peripheral, okay, peripheral artery disease. So, typically appears at ages in the 6 to 8 decades of life, so it's down the road. But it's some of the similar risk factors that we talked about earlier. Tobacco, hypertension, diabetes, decrease in activity. Peripheral artery disease may affect, because we're talking peripheral. So what are your peripheral pulses? Do you guys know your peripheral pulses?
Yes.
There you go. And so femoral, popliteal. Where's the popliteal? There you go, guys. And what's the well, these are I'm mentioning some of them, but posterior tibia. Where is that located? No.
But that's the salad.
Yeah. What's that one called though? There you go. It's going to be in here. So when you're testing, your hands will be like this because you're comparing them while the patient is either sitting or lying down. Okay? All right. I'm going quickly here. I'm not going to do the case study. Classic symptoms. Intermittent claudication. What does that mean? Intermittent claudication is a typical sign for PAD. That means pain when I walk. That means as I'm walking, I am experiencing pain, and it's probably the claudication, and it's related to the PAD. It's the most typical symptom, okay? Paresthesia, numbness and tingling. Because now we're dealing with peripherally, so they could have some, you have to inquire about that. They have to tell you if they are experiencing that. Thin, shiny, taut skin. I wish I had a visual to show you that, but I don't. I might go put one in here. Diminished or absent fetal, popliteal, femoral pulses. You got to check your pulses. Okay.
Would that be like bilaterally, like equal, or one side?
You always You always check bilaterally, so at the same time.
I mean, like, will one pulse be more diminished than the other? Or
It could be. That's why you're doing them both at the same time, so you can compare. And you would document that. If one is greater than the other, you would document that. Okay? Pain at rest at PAD progress occurs in the feet or the toes. Chronic extended rest pain lasting more than 2 weeks is not good for these patients. Complications, of course, peripherally, delayed healing, tissue necrosis, arterial ulcers could develop wound infection. Non-healing arterial ulcers are pretty serious compared to venous. Could cause gangrene. That's why you do your 5Ps, which is related to your neurovascular check. We could use if you can't feel a pulse, get a Doppler. Tobacco, we can change this. This is modifiable. Progressive treatment for hyperlipidemia, we can do that. These are Alpate, or Bremfril is your as an ACE inhibitors. You should have learned about your calcium channel blockers, your beta blockers in your ACE inhibitors in your form. I hope. Go back and review. Antiplatelet agents, Plavix, aspirin, okay, can sometimes be used as therapy. These are some other simple treated for the claudication. So look at that slide. Going through ambulatory, I'm not going to worry about acute care. Monitor for so in reference to the PAD, I want you to go back. Look at the slide that addresses the nursing implications. Okay, that's going to tell you what your role is. So I mentioned continuous circulatory testing. So checking your 5Ps, your neurovascular check, that's what that is about. Turning position frequently. Again, we're peripheral, so that's where we're dealing with. Okay. Noting the skin color and temperature, sensation. So this is all about your 5Ps. Health promotion, diet modification, exercise, proper feed care, particularly your diabetic patients. The overall goals for patients with PAD, adequate tissue perfusion, relief of pain, increased exercise, healthy skin, increased knowledge of the disease and the treatment. That's what we want to focus on. Okay. The most surgical approach is peripheral artery bypass. And that's where they take they do a bypass and take a strip of venous. They can do stenting, but they may do peripheral artery bypass. Looking at grafting. All right, guys. Now, so we talked about this. I know it's a lot of information. Someone emailed me. Can you email me to remind me about that one I wanted? Absolutely. Which one was that? 33. 33? Yeah, just to make sure I get that. And then repost it. Now, any questions, guys? I know it's a lot of information, but I